Well, the very first time in human history, we are collectively living longer than ever before. It's a truly remarkable achievement, but it ushers in a fascinating challenge. Today, we're taking a deep dive into that challenge, specifically exploring the critical distinction between health span and lifespan.
It's a crucial distinction, isn't it?
Yeah.
Lifespan is simply the years you're alive,
Yeah.
a straightforward count. But health span, that's the truly important metric for quality of life. It's the years you live in good health.
Good health meaning, like, free from really debilitating conditions.
Exactly, or with chronic illnesses well managed. It's about the vibrancy, the capability within those added years, not just counting them.
And here's where the data from Singapore offers a really compelling and maybe a bit sobering case study for the world. While the average life expectancy here is, well, fantastic, 84 years, the healthy life expectancy dips dramatically to just 74 years.
The full decade gap.
Yeah, that's a full decade. Imagine 10 years where you might be alive but not really thriving, not in good health. For any business or investor listening, that gap, well, it represents both a challenge and, frankly, an immense opportunity.
That 10-year discrepancy is precisely what prompted the report we're looking at today. It's the Healthspan Barometer, evaluating public perspectives on healthy aging in Singapore.
This is published by Economist Impact, that's the research arm of the Economist Group, and sponsored by Prudential, the global insurance giant.
Right. And our mission today is to unpack this report, to dig into its key findings, and most crucially for you, the listener, to identify the significant business and investment opportunities that, well, emerge from these insights.
Exactly. We'll explore how things like individual resilience, smart financial planning, and robust social structures are all interconnected in fostering healthy aging.
What's particularly intriguing, I found, is that despite many survey respondents reporting good health today,
There are these palpable anxieties about the future, especially among Gen Z. This isn't just a social concern. It highlights a critical need for early action and, honestly, a demand for groundbreaking new solutions that could really define the next wave of health and wellness investments.
definitely. So where should we start? The definition itself.
Yeah, let's start there. How health span is defined in the report and how the public actually perceives it. You mentioned experts might have slightly varied definitions, but the core idea is living free from chronic conditions or having them really well managed. But the report pushes beyond just the physical, doesn't it?
It absolutely does. And this is fascinating. Wang Moy Tan from Singapore's Ministry of Health's Office for Healthcare Transformation pointed this out. She said, many people in Singapore think of health as mainly a person's physical condition. We need to start seeing this more holistically without compartmentalizing the different facets of health. So the report really expands this vision
To include what specifically?
to include mental and emotional health, financial capacity, and even your social and physical environments. It's much broader.
Right.
And understanding this broader definition is, I think, key to seeing where the next wave of health-related services is going.
Okay. And when Singapore residents were actually asked what they prioritize for healthy aging, what came out on top?
Being physically active was number one at 43%. Then, being free from chronic disease or maintaining cognitive function, both tied at 35%.
Interesting. And financial security, emotional balance.
You were there too. Financial security got 27% and emotional balance 25%. So you can see there's an emerging understanding of this broader definition. But one demographic really highlights a shift in priorities.
Gen Z again.
Exactly. Gen Z. Their distinctive concerns really stand out. They place a considerably larger emphasis on emotional balance compared to other groups. Y. Mun Lim, from Dr. Anywhere, notes that Gen Z's anxiety isn't just about living longer, but how well they'll live.
Right, because they've grown up more aware of mental health issues.
Yes, precisely. Aware of mental health, wellness concepts, broader societal challenges, it shapes their perspective.
Andre Mayer from NUS, she underscores this too, right? Talking about the post-pandemic shift.
She highlights a significant shift post-pandemic. Younger people are recognizing work-related stress more, valuing work-life balance much more, and this, for any entrepreneur or investor listening, is a really clear signal.
How so? What's the specific opportunity?
Well, the insight isn't just that Gen Z wants mental health support. It's that they seem to respond uniquely to, say, hyper-personalized, perhaps gamified, community-driven platforms. Things that integrate mental wellness into daily routines, maybe moving beyond traditional therapy models that might feel stigmatized. It feels like a greenfield for digital-first wellness solutions.
Okay, that makes sense. Digital first, integrated wellness. Now let's pivot to the future, because despite this current reported good health, the survey reveals a lot of anxiety. And this is where that financial planning element really shines as potentially a huge investment opportunity.
It really does. The numbers are quite stark. A staggering 62% of respondents aren't confident they can maintain good physical health in old age.
62%. Wow.
Yeah. And for mental health, it's 45% lacking confidence. And then the big one, financially speaking, 43% lack confidence in their ability to finance old age healthcare needs beyond age 75.
That anxiety is just palpable, isn't it? It really underscores the financial dimension of this whole health span challenge.
Absolutely. Brian Kennedy, distinguished professor from NUS, he articulated it really well. He said, people are afraid of living a long time and not being healthy for a lot of that time, and that's why we need to focus on health span, compress morbidity, and narrow that gap, that 10-year lifespan, health span discrepancy. It's a potent source of fear that business can actually address.
Indeed. And when you drill down into the financial specifics, it gets even clearer. 41% are concerned about affording medical bills and nursing care for long-term conditions. That worry is even higher among Gen Z, interestingly.
And the same percentage, 41%, fear exhausting their savings because of unexpected health issues. This isn't just, a personal problem people are facing. It signals a market that's ripe for new financial instruments, new ways to plan.
So how are people currently planning to cope? What does the report say?
Well, it shows a heavy reliance on Singapore's Central Provident Fund, the CPF. 61% plan to rely on that, and 59% plan to rely on their cash savings for future health care.
Okay, so there's some planning there, but is there a catch?
There is. Here's a crucial market insight, I think. Despite 59% planning to rely on cash savings, only 46% are actively accumulating savings, specifically for future health expenses.
So there's a gap between intention and action. That's a 13-point discrepancy.
Exactly, and that discrepancy reveals a massive unfilled need, a need for accessible, goal-oriented financial products and services focused specifically on health savings.
And what about insurance? Does that play a role?
It does. 53% plan to use health, life, or other insurance. That number jumps to 61% among millennials, which is interesting. So it suggests a strong existing appetite for insurance products, but also plenty of room for growth, especially when you consider that overall confidence gap we talked about.
So the opportunity there for insurers is maybe to innovate beyond just traditional products.
Precisely. Perhaps offering things like Healthspan-linked policies or policies with built-in preventative wellness incentives, things that actively support Healthspan, not just cover sickness.
The experts in the report, they seem to agree that Singaporeans generally have a better financial understanding these days, but there's still this critical need for rainy day planning, particularly for health.
That's right. Kenneth Mack from the Ministry of Health, he emphasizes the need to instill financial literacy for health from a young age. This feels like a really clear call to action for financial institutions, for edtech companies focusing on finance, and for insurers too.
A call to action to do what specifically?
To develop and scale programs focused squarely on healthcare financial planning, budgeting for unexpected health events, explaining the role of various financial products, insurance, investments in securing a robust health span. You could imagine financial wellness platforms tailored specifically for future healthcare costs, for example.
Okay. So moving on from personal finances, let's look at individual resilience and social structures. These also present some compelling investment opportunities, right?
Definitely. On the physical health side, while government initiatives like the National STEPS Challenge show some results in promoting activity, adoption of healthy behavior still has quite a bit of room to grow.
What did the numbers say there?
Well, only about 31% of respondents engage in moderate physical activity more than twice a week, and 36% consume sugary drinks twice a week or more. That jumps up to 47% for Gen Z. So, clear gaps there.
And this is where those peer networks you mentioned earlier come in.
This is where they become incredibly powerful, yes. Both Kenneth Mack and Dr. Tan stress their importance for encouraging healthy behaviors. They mentioned examples like a healthy sandwich club started by children. It sounds simple, but the principle is key.
So the insight for businesses is to leverage that social dynamic.
Exactly. This opens up real business opportunities for corporate wellness programs, for community health initiatives, for digital platforms that can effectively integrate social dynamics,
Yeah.
gamification maybe. Imagine health apps that create virtual sandwich clubs or, competition-based wellness challenges within communities or workplaces.
Right, making it social, making it maybe a bit fun. And when we talk about mental health beyond just Gen Z, cognitive decline is a common concern across all ages, the report says. But there's more to it.
Yes, the mental impact of chronic physical conditions is also really significant.
Yeah.
And what's interesting, coming back to Gen Z, is that loneliness and isolation are a strong concern for them, much more so than older groups.
Is that seen as a negative?
Well, Professor Mack actually sees this positively, in a way. He notes that younger Singaporeans seem more willing to articulate and seek help for mental health concerns. And that willingness itself signals a demand for accessible, perhaps discreet, and definitely destigmatized mental wellness services.
Okay, so demand is there. What about the environment? How can our surroundings support well-being better?
This is another important area. The report highlights that respondents really value things like free fitness facilities, green spaces, accessible public transport, all polling around 32% importance. Dr. Tan points to the need for localized urban planning approaches.
Which points to opportunities for.
For developers, urban planners, smart city solution providers, opportunities to integrate health-promoting infrastructure and amenities right into communities, making healthy living the default, the easy choice.
And it's not just physical spaces, is it? What about technology adoption?
Ah, yes. The adoption of health tech is remarkably high in Singapore, according to this report. 62% use mobile health apps, 50% use wearables like fitness trackers, 54% use telehealth services.
That's pretty high across the board.
It is. And Professor Mack notes that seniors are increasingly comfortable with smartphones, which is key for adoption across age groups. This truly highlights a robust and, I'd say, eager market for health tech companies.
Eager for what kinds of tech?
Everything from sophisticated wearables and remote monitoring devices to comprehensive telehealth platforms and even AI-driven personalized health management tools. The demand is clearly there. The challenge and the opportunity is to innovate beyond current offerings to drive deeper engagement and, crucially, tangible health outcomes.
Okay, that brings us nicely to a final crucial point. Bridging that gap between awareness and actual adoption.
Yes, this is key. Government initiatives like Healthy 365, the National Steps Challenge, Health Hub, they have really high awareness, around 90%, but adoption, as the report shows, lags significantly. It ranges from maybe 50–60%.
And for money sense, the financial education program.
Even starker. Awareness is pretty good, 73%, but adoption is only 25%.
Wow. That's a significant chasm between people knowing something exists and actually using it. Why is that?
Professor Mack offers a perspective. Often, people just don't feel sufficiently incentivized or motivated to adopt these programs long term. It's the what's in it for me factor, perhaps.
And Dr. Tan calls for greater customization.
She does. She says we need to dig deeper to understand the different archetypes of people and based on that to take a differentiated approach to their needs. One size just doesn't fit all. And Wyman Lim adds another layer, suggesting sharing more personal stories, making the experience relatable, encouraging deeper emotional engagement.
So this awareness adoption gap, it's not just a problem, it's another signal for businesses, isn't it?
The powerful signal, yes. The key insight seems to be leveraging behavioral nudges, perhaps loyalty programs, things that make healthy choices the path of least resistance. And crucially, integrating these into existing digital habits, rather than requiring people to adopt entirely new platforms or routines.
So the opportunity is to
Partner with government, potentially, or develop your own solutions, focusing on that personalization. Personalized health coaching, smart incentive programs using compelling storytelling, all aimed at increasing engagement and, importantly, sustained adoption of healthy living products and services. Think hyper-customized wellness plans or community challenges sponsored by businesses that reward sustained healthy actions, not just signups.
Okay, so when we connect all these dots, the report's next steps section really seems to outline these prime areas for business and investment quite clearly.
They really do. First, there's that strong call for financial health literacy, with an explicit focus on future healthcare needs emergency funds, that rainy day planning for health. This feels like a greenfield area for new financial product development and education, moving beyond general savings advice to health-specific financial resilience.
Second, the report underscores the critical need for private sector partnerships.
Yes, the government explicitly states it cannot address every health need on its own. That's a huge signal, really. An open invitation for health tech, financial services, wellness companies to step up, bring their resources, their expertise to expand the reach and support for healthy aging.
Third, community involvement.
Right. Tapping into those peer networks we discussed, leveraging civic organizations. This invites local partnerships, maybe more grassroots business models. Imagine businesses supporting and scaling those healthy sandwich clubs or similar community-led initiatives, turning social connection into a real driver for health outcomes.
And finally, that point about program customization.
Exactly, moving beyond one-size-fits-all. Tailoring initiatives to specific needs, motivations. This creates real demand for data analytics, for personalized health solutions, for niche service providers who can understand and address those varied archetypes Dr. Tan mentioned, delivering truly impactful and, importantly, sticky solutions.
It really feels like Singapore is positioning itself as a leader here. Brian Kennedy's optimism about the country potentially becoming a world leader in Healthspan if the commitment remains. That frames this as a strategic advantage for businesses, doesn't it?
Absolutely. This isn't just about a local opportunity in Singapore. It's effectively a test bed for innovations that could potentially be scaled globally as many other nations grapple with their own aging populations. The market isn't just open, it feels like it's actively seeking partnership and innovation. And Singapore seems determined to lead the way.
Which leads us to a final thought, perhaps for you to ponder. So if healthy aging isn't just about avoiding illness, but really about purposeful living, financial security, strong social ties, what groundbreaking innovation or investment do you think will truly help bridge that 10-year gap between lifespan and health span? Not just for Singapore, but maybe, potentially, for the world.
That's the multi-billion-dollar question, isn't it? Finding those scalable, impactful solutions.
Indeed it is. Well, thank you for joining us on this deep dive today. We hope you feel more informed and perhaps even a little inspired by the opportunities in building a healthier, longer future for all of us.